and welcome to Your Health. And of course, as we age, certain parts of our bodies seem to age where we can see it. Gray hair, but we always have ears, we have a nose, we have a throat. And today we have with us a specialist in ear, nose, and throat, recently moved to Montgomery, Dr. Lee Watkins. First of all, welcome to Montgomery.
Thank you very much.
You're part of the Baptist Health System here.
Yes.
So you have your offices, so you can see patients immediately.
Correct.
And of course, what we talked earlier before we got on the air, a lot of times you go see your general practice doctor probably once a year, and they do a precursory, I'm going to kind of ding a little bit in your ear and maybe look at your nose, feel like this. But sometimes if it's not feeling right, you need to visit a person such as yourself.
Right. And some of the more common things are a sensation of a lump in the throat or excess mucus in the throat. Could be from the nose, could be from the oral cavity, could be from the swallowing tube, the esophagus. And we have to investigate the complaints more thoroughly and then look on the physical exam to see what might be more afoot in the cause.
Absolutely. And of course, when people are starting to have these problems, you do need to maybe start with your general practice doctor.
Correct.
You may sometimes have to be referred, but many times we can just call you directly. If you call Dr. Watkins' office directly, they can let you know right then and there if you'll need a referral, right?
That's correct. It's based on what insurance plan you have. Some insurances require the referral and some do not. So it's best to ask.
And we're big proponents on this program of telling our viewers, you've got these precious things, your throat, your ears, your nose. How do you keep them in great shape as you start to age? Some hints.
The ears, for example, that care starts in your teens.
Isn't that amazing?
With loud noise exposure, loud music playing in a rock band. That's not going to show up as much in your teens and 20s. It's going to show up in your 40s.
Is
and the
that
damage
right?
has already been done. You've already set the course.
So there's no turning back.
Correct.
No turning back at that point.
Not in our current technology.
And not in our current technology. Well, and then of course we were talking earlier too about how do we want to keep our ears clean? A lot of people go to that old famous Q-tip.
Yes, you'll notice on the Q-tip box, it has a black box warning, do not use in the ear canal. And we see a lot of ear canal injuries, torn canals and even ruptured eardrums. And people often say, well, I get a lot of wax out when I Q-tip. You get about half the amount of wax out. The other half you've pushed further in. That just has to continue to try to make its migration to the outside.
Okay.
The better way for long-term control is once a week, just flush the ear canal with some peroxide, straight out of that brown bottle, the 3% peroxide. Let it bubble up for a half a minute to a minute, and then let it drain into a softly crumpled Kleenex. And while you're draining one ear, treat the other ear. Let it sit, then drain that one too.
That's great. That's a good way to do it. Because obviously, when you're pushing the wax in, that can also affect your hearing, right?
Yes, it makes nature's best earplug also.
That's amazing.
That's one of my immediate gratifications. Somebody comes in with a dense hearing loss. They can't hear what's going on around them. We take the wax out. Wow, I can hear again.
Wow. And our viewers need to know that your ears, your nose, and your throat are interconnected.
They're all connected. Yep.
And a lot of times something that's happening in your throat, as you mentioned earlier, can be starting in your nose or in your ears and winding up in your throat.
Correct.
Gravity goes down.
And when somebody comes in complaining of ear pain, we look in the ear looks normal. We have to look in the throat, and we have to look at the jaw joint also. That pain can be referred to the ear from another part of the head.
Wow. So basically, if our viewers want to get some information on proper care, they can obviously go and have an appointment with you.
Correct.
And at that point, you're able to give them exactly what they need.
Well, more close to exactly what they need. We strive for exact, but sometimes we just get close.
Okay, so you would be working also with their vocal cords?
Correct.
Because it seems as people start to age, they start to talk a little softer.
There are many different things that can be changing about the vocal cords that affect the voice. And it's a very sensitive area that will show symptoms with the earliest of changes, from thickening of the mucosa to a loss of the fat layer below the mucosa that allows it to vibrate normally like a finely tuned wind instrument. Vocal cord polyps or nodules from harsh speaking, chronic coughing, or just loud voice use, like a coach or a teacher in school. Vocal cord nodules can cause a certain pattern of hoarseness as opposed to a nerve weakness that might be caused by a nerve problem going from the base of skull down around the great vessels of the heart on its way back up to the vocal cords. They have a rather long course where it can be affected anywhere along that course.
And a lot of that is a part of aging process in general.
Yes.
And then a lot of it is caused, as you said, if you had the kind of a job where you were yelling or talking a lot, it can affect it.
It's not just how old the organ is, it's how that organ is being used.
Or abused.
Or abused.
Or abused,
True.
as it can happen. Well, Dr. Watkins, thank you so much for this information. Again, if a person has information, you can reach them through Baptist Health. Call Baptist Health. Ask for Dr. G.L. Watkins.
Right, or G. Lee.
Or G. Lee. That's right, G. Lee Watkins. We're just going to go with Lee Watkins. It'll make it a lot easier. Absolutely. And you can set up for an appointment. You're in a practice with another physician.
Dr. Kang Nguyen. He started a couple of months before I did. And so it's a new department in Baptist South.
Great. Well, welcome to Montgomery. You're going to enjoy it here.
Thank you.
And just remember this, your ears, your nose, and your throat are very important organs on your body. Take good care of them. If you're having a problem, make sure early detection is the best way to take care of a real bad problem. We'll be right back right after this.